So I want feedback on a case, clinical case that I have. Okay, the clinical case is history of uh, history of low back pain, chronic low back pain, acute chronic low back pain, discogenic pain, etc. Right? So and so essentially what I'm trying to do. So
This is a client of yours.
this is a client of mine, and I'm trying to I've treated this individual for like quite some time now. So we're actually in a really good space. He's actually back to like strength training, and he's in the gym and stuff like this. But it was interesting. I had a lot of success in this specific client when what I would do, right? So I'll give you some more details. So on segmental flexion and extension of the lumbar spine,
Hmm.
right? Like it was not very good, right? So extension wasn't bad, but like essentially couldn't get into flexion.
Okay.
Does that make sense?
Mhm.
So and when you like cue him to get into extension, he can extend, you can palpate down to the multifidi, right? Like that stuff was deconditioned for sure. And it was like real flickery and on and off, like,
Hmm.
right. But then like he
Hmm.
was able to lock it in quite quickly, but then still was just like essentially almost flexion intolerant, right? Where he like you just couldn't he couldn't get like the lower like let's say the lower three lumbar spine to flex.
Got it. Okay.
Okay. And we had been treating him enough. And also this is kind of an interesting case. I'm just going to throw this out there. So he initially had a injury. So he's
Okay.
a former firefighter where a roof
Okay.
fell on his head and
Oh, geez.
essentially injured three of his vertebrae, like essentially like in his thoracic, and
His upper thoracic.
he had them artificially replaced, the discs artificially replaced.
Oh, he had the Tiger Woods surgery.
Yeah, yeah. But hold on, stay with me. But that injury was there because it was an issue at work. But
Okay.
like he'd lost a lot of joint space, and I can't remember what he told me. This is crazy, dude. This is so he told me that he was like significantly taller after the surgery.
I was gonna say he shrunk, right? Or
Yeah,
he shrunk and then after the
he
surgery he got taller.
right. But then he was talking about how he had widespread spasm and neurological tightness throughout his whole entire spine because of the new length that was acquired through surgery. But the nervous
Oh,
system
wow,
was
interesting.
okay. But stay with me. And then he was on muscle relaxers for over a year and a half before he came. Not
Oh,
not like
holy.
yeah, they just kept giving him to him.
Right.
Okay. So he essentially had like a suppressed neural network of absolute strength.
Right.
Does this make sense? And then he was told to just through his medical doctor, because when I was doing his like point A intake, I was like, how long have you been taking these? And he's telling me this. And I'm like, I don't know. I'm not a doctor, but that like I've worked in medical before. And I'm like, I know for sure like none of the clinicians that I worked with would like that's like contraindicated. So
Yeah,
then he's
who keeps
told to
fulfilling that prescription?
yeah. So then what ends up happening is they tell him to just immediately stop. So then he's having all these crazy spasms, right? Because he's probably used to that nervous system getting tamped down and now it's not.
Hmm.
So anyway, like he was really contraindicated for any type of like FR treatment, any type of because the nervous system, right? But I had to get him to figure out how to segmentally flex his lower vertebrae. Okay. So what I did, and it worked, and that's why I kind of want to understand more from your perspective. But if you, so I needed him to obviously like I'll share this. I know you know where it's at, but I'll share it. So like there's the psoas. So you can see the
Yeah.
psoas attaches up here to T12. It attaches to all the vertebrae, and then including these intervertebral. Does it attach to the intervertebral discs?
It sure does. Yep.
Yeah, because when you put them on here,
And
you can
and
see it.
and the ALL. So there's the ALL right on the front of the spine. It'll make a nice
Oh, yeah,
connection in there as
okay.
well.
Oh, okay. I didn't know that.
Yep.
Okay. So this is what I was this is what I so so obviously I need to show him how to use that muscle because he can't use them like he can knows what multiply are, has no idea what psoas is.
Sure.
So he keeps trying to use his abs, he's bowing at his thoracic cavity, he's shooting his pelvis down, he's doing everything, and that's all irritating his spine as well. Because
Yeah,
it's
because
like
he's
it's like
continuing to try to go into flexion to do so.
yeah. Okay. So what I ended up doing is I palpated down to essentially his lower vertebrae, right? And once I palpated down, like I went east to west so that I knew like if the sun is here and it's going north south, I like palpated down to here and then I strummed over each side.
Okay.
And I just started to I didn't have the intent to treat it. But it's like it's so tight on him that as I'm palpating and I'm strumming across it, he's like, "Oh, what is that? Oh, it's so like it's not it's that it's painful. I don't describe it as painful. It's uncomfortable
Yeah.
because he's feeling how tight like the neural network is like we don't want any length through here,
Sure. Definitely.
right? And so I'm just like palpating down, and then when I palpate to the spine, all I did was just low level IsoRamp. Hey, right? Like I didn't my intent, but like this is really important. And like you taught me this, right? So that's why it's like most people would go, "Hey, I'm going to treat the psoas." And they would think, "Okay, well, it's the connective tissue. I'm going to try, right?" But like that was 100% everything that I told you. This guy had a traumatic injury. He then got his spine lengthened, right?
Yep.
This is happening over time. So this is a chronic case. Then
Yep.
he's on all these muscle like his nervous system is clearly like what his neural
What is
network of
going on?
absolute strength is like I have no idea what's going on.
Sure.
Right. And so it's interesting when I started to think about like reactive strength, right? And it's like, well, he can't feel the tissue because the nervous system is not allowing any length. So he can't feel any of the biological tissue. So that's why we're probably having disc issues. If the white tissue that we just showed up there doesn't get loaded, right? Like it's going to go deeper into the disc, and this is his discogenic stuff,
Yep.
right? But it's interesting to get back because I keep going down these rabbit holes. But once I layered down to the psoas, bless you. It's funny how when I was doing it, I was like, this is what is indicated to do, but it doesn't feel like I'm doing much of anything. So I can see why people wouldn't program this way in the clinical space. Does that make sense?
Because
Like,
yeah, because and are you saying that because most people in the clinic feel like they mo- most practitioners in the clinic feel like they need to get a patient response where the patient is going, "Oh yeah, that hurts so good," or something along those lines to actually make it feel like they're doing something.
correct,
That's
right?
probably what you're thinking, right?
Yeah, because I'm thinking
And and
oh
I
yeah, no,
think
go
what
for it.
you did, which is the art of being a good clinician, which is understanding that what you're acquiring whenever you palpate or you move something around or you try to move a tissue at length is all what you're gathering is you're just on an information gathering expedition whenever you do anything
Mhm.
like that.